The senator from Arkansas.
Mr. President, healthcare workers have long been regarded as some of our nation's most critical and courageous servants. During this time of challenges and uncertainty, this has never been more accurate. Each day, our healthcare professionals make tireless sacrifices to protect and serve our country, even when it means risking their own lives to take care of others. People like Jennifer Campbell, a registered nurse with White River Health System, are a great example. She's recognized as the in-house expert for all COVID-19 testing. She has taken ownership of the community drive-up testing and worked with the Arkansas Department of Health to organize community testing. In Malvern, Vicki Robbins, a registered nurse at the Baptist Health Hot Spring County, has volunteered to work extra hours, offered to operate the drive-through screening, and volunteered to treat COVID-19 patients. And Laura Turknett, a registered nurse at Baptist Health Conway, has been dependable and flexible with the hours she works to support the needs of different shifts. She provides compassionate care with a positive attitude. I was honored to personally thank frontline workers like them and so many others for the critical care they are providing during visits to medical facilities across Arkansas during the in-state work period. The work these frontline workers and their colleagues do has become much more difficult. We are grateful for all they do and represent. Congress overwhelmingly supported the men and women of the medical community who are treating COVID-19 patients and working to find a cure to address the public health crisis with the passage of the CARES Act. This critical relief was a necessary lifeline for hospitals to continue providing services to meet the demands of communities, helping our doctors, nurses, and other medical professionals stay safe while providing care and treatment for patients. There is more that we can do to support health care and ensure patients get reliable care. Listening to the needs of hospitals is incredibly important in many efforts to assist these vital facilities, protect the jobs they create, and empower their ability to serve communities and patients all across Arkansas. Insight from the healthcare community is a valuable resource that helps shape the policies that directly impact their mission. Along with continuing to provide critical resources like PPE, here are 3 things Arkansas healthcare professionals recommend we can do to improve services. First of all, expand broadband so more patients can take advantage of telehealth. Make expanded telehealth services to Medicare permanent, and finally provide certainty for the 340B drug discount program. Telehealth has become vital to providing effective care for patients during this public health emergency. Access to medical providers without leaving home offers convenience and safety against potential exposure to COVID-19. Having the option for virtual doctor's visits can be a challenge, particularly for rural areas where broadband connectivity is limited. This emergency has amplified the need for this connection, but too often providers in rural communities are unable to meet the increased demand for telehealth efforts and services. My colleagues and I have introduced legislation to help healthcare providers expand telehealth benefits and improve access to broadband. The Healthcare Broadband Expansion during COVID-19 Act would bolster funding for providers in rural areas to increase connectivity. This bill would help more patients get the care that they need. We have a unique opportunity to see how the modifications and updates we need to make health programs during this health emergency so that they can be beneficial for the long term. The CARES Act provided the Department of Health and Human Services with the authority to waive telehealth requirements for Medicare during this emergency. providers and patients have adapted expanded telehealth opportunities. We can continue to strengthen this access by making these services permanent. Earlier this summer, I joined a bipartisan group of senators urging our nation's top health agencies to make permanent changes to telehealth requirements for Medicare that Congress authorized in the CARES Act. Last month, President Trump issued an executive order to improve mental health care in rural America by expanding telehealth resources and services. The President's action included a proposal to parts of the Medicare telehealth coverage. This is a step in the right direction. I look forward to working with the administration to implementing a rule that will enhance the delivery of health care to Medicare patients. When Arkansas hospital administrators shared their concerns over eligibility in the 340B program, I signed on to support Senator Thune's bill to provide certainty to current participants. As hospitals paused elective procedures and admissions decreased for Medicare and Medicaid patients, administrators' concerns that their hospitals will no longer be eligible for the 340B program increased. These are among the key metrics used to determine acceptance into the program. The 340B drug discount program has provided flexibility to Arkansas hospitals to help lower drug prices. Extending eligibility so they can care for low-income patients is critical. These are three measures we can take to help patients continue to get quality, reliable care. We must remember that, like our valued healthcare workers, we play an important role in fighting the virus. By following the guidance and recommendations laid out by our public health officials, we can help our medical heroes and make a positive impact to prevent the spread of COVID-19.